The room was eerily quiet, save for the rhythmic hum of machines and the occasional sharp beep from a heart monitor. Nurses moved quickly, their faces hidden behind masks that barely concealed their worry. In one corner of the ICU, a frail woman lay motionless, her chest rising and falling in shallow, labored breaths. Her name was Eleanor, and just weeks ago, she had been celebrating her 82nd birthday with her grandchildren, laughing as she blew out the candles on her cake. Now, she was fighting for her life, and no one could pinpoint why. Her family watched helplessly through the glass, their faces etched with a mix of fear and confusion. The doctors had run every test they could think of: influenza, pneumonia, even COVID-19. All came back negative. Eleanor's condition continued to worsen, and the medical team was running out of options. Her daughter, Susan, clutched a rosary in her trembling hands, silently pleading for answers. But the truth was more elusive and more insidious than anyone could have imagined. Why was Eleanor's life slipping away? Why were so many seniors like her falling gravely ill, their symptoms defying standard diagnoses? And why, despite the mounting cases, did no one seem to be talking about it? The answer lay in a microscopic adversary that few had heard of: human metapneumovirus, or HMPV. For years, this silent predator had been quietly infiltrating communities, preying on the most vulnerable. Scientists had identified it decades ago, but public awareness lagged far behind. Unlike the viral giants that dominated headlines, HMPV operated in the shadows, leaving a trail of devastation that was largely invisible to the outside world. Each year, it crept into nursing homes, senior centers, and family gatherings, spreading its invisible tendrils through coughs and sneezes. For most, it presented as a mild respiratory illness, easily mistaken for a common cold. But for the elderly and immunocompromised, it was a ticking time bomb, one that could escalate into severe complications like bronchitis, pneumonia, and even death. The statistics were staggering. Studies revealed that HMPV had been linked to thousands of deaths annually among seniors in the United States alone. Yet, shockingly, few outside the medical community knew of its existence. Why was this silent killer allowed to thrive unchecked? Why wasn't it making headlines, sparking public outcry, or rallying researchers toward a cure? The story of HMPV is not just one of medical mystery. It's a tale of systemic failure and societal neglect. And at its core are people like Eleanor, grandparents, parents, neighbors whose lives are shattered by a virus that should not have gone unnoticed. Eleanor's journey began innocuously enough. A slight cough here, a bit of fatigue there. At first, her family brushed it off as nothing more than a seasonal bug. After all, she had always been strong, fiercely independent. But within days, her condition spiraled. Fever spiked, her breathing grew ragged, and she became too weak to leave her bed. By the time she was rushed to the hospital, her oxygen levels had plummeted, and she was barely conscious. As doctors scrambled to stabilize her, her family grappled with a whirlwind of emotions. Guilt for not recognizing the severity of her symptoms sooner, anger at the lack of answers, and an overwhelming fear of losing her. They were not alone. Across the country, countless families were experiencing similar heartbreak, their loved ones succumbing to an illness that defied explanation. How had we allowed this to happen? How had a virus with such deadly potential slipped through the cracks of public health awareness? And more importantly, what could be done to stop it? The answers are as complex as they are urgent. HMPV thrives in the shadows, its impact masked by a confluence of factors: limited testing, misdiagnosis, and a healthcare system stretched too thin to prioritize lesser-known threats. Unlike COVID-19, which triggered global lockdowns and unprecedented vaccine rollouts, HMPV lacked the spotlight, the funding, and the urgency needed to combat its spread. But the consequences of this oversight are impossible to ignore. For every Eleanor, there are thousands more. Lives cut short, families torn apart, and communities left grappling with grief. As we delve deeper into this untold story, one thing becomes painfully clear. The silent epidemic of HMPV is a crisis that demands our attention. And so, as Eleanor's story hangs in the balance, we are left with a haunting question. How many more lives must be lost before we finally start to listen? It begins with a question, a simple, haunting question that lingers in the air like the faint trace of a storm on the horizon. What if there was a silent killer targeting the most vulnerable among us, and no one was sounding the alarm? This is not a story of distant possibilities or abstract fears. This is happening right now, in neighborhoods like yours, in families like yours. It's happening behind the closed doors of nursing homes, in the quiet corridors of hospitals, and in the safety of living rooms where grandparents cradle their grandchildren with love, unaware that a shadow looms over them. Human metapneumovirus, or HMPV, doesn't make headlines. It doesn't inspire public health campaigns or spark urgent debates on Capitol Hill. But its impact is undeniable. It disproportionately affects seniors, slipping past weakened immune systems to wreak havoc in ways that are devastating and too often fatal. This virus isn't new. Scientists have known about it for decades. Yet, for reasons we'll soon uncover, its story has remained largely untold, its victims largely ignored. Why? Why has something so dangerous been allowed to remain in the shadows? And what can be done to stop it before it claims more lives? By the end of this documentary, you'll have the answers to those questions. You'll understand the truth about HMPV, how it spreads, why it targets seniors, and what makes it so deadly. More importantly, you'll gain the tools to protect yourself and your loved ones from its grasp. But this isn't just about prevention. This is about justice. Because beneath the science and the statistics lies a deeper story. A story of neglect, of systemic failure, and of lives lost unnecessarily. It's a story that demands to be heard. A story that demands action. Take, for instance, the case of Robert, a retired schoolteacher who spent his life shaping young minds. At 74, Robert was healthy, active, and full of life. He volunteered at a local food bank, played bridge with friends every Wednesday, and doted on his grandchildren. Then, one winter evening, he came down with what seemed like a simple cold. A week later, he was gone. His family was shattered. The doctors called it pneumonia, but when they pressed for answers, they learned the truth. Robert's death had been caused by a virus they'd never even heard of, HMPV. The grief was compounded by anger. How could they have protected him from something they didn't even know existed? Robert's story is not unique. It is one of countless tragedies that could have been prevented with greater awareness, better testing, and stronger public health initiatives. It is a story that illustrates the cruel indifference of a system that has failed to prioritize the health and safety of its most vulnerable citizens. But there is hope. There are steps we can take, both as individuals and as a society, to fight back against this silent epidemic. And it starts with understanding. In the next few chapters, we'll break down the science of HMPV, revealing what makes it such a formidable adversary. We'll explore the ways in which it exploits the aging immune system and why seniors are particularly at risk. We'll examine the societal factors that have allowed it to flourish in the shadows, from underfunded research to inadequate healthcare access. And we'll share practical, evidence-based strategies to protect yourself and your loved ones. This is not just a story of loss, it is a call to action. Because the truth about HMPV is not just a medical mystery, it is a mirror, reflecting the vulnerabilities of our healthcare system, our communities, and ourselves. So as we continue this journey, ask yourself, what is the cost of ignorance? How many more lives must be lost before we begin to take this threat seriously? And what can each of us do to ensure that no one else has to endure the pain of losing a loved one to something so preventable? The answers lie ahead. Stay with us. It goes by an unassuming name, human metapneumovirus, or HMPV, a name that rarely makes headlines, that doesn't stir up fear in the public consciousness. And yet, HMPV is a silent predator, slipping through the cracks of awareness and striking the most vulnerable among us, the elderly. But what exactly is this virus? It was first identified in 2001 by researchers in the Netherlands, though evidence suggests it has been circulating among humans for decades, perhaps even centuries. Unlike the well-known villains of the viral world, like influenza or COVID-19, HMPV operates quietly, without the dramatic outbreaks that force governments and health organizations to take notice. HMPV spreads like many respiratory viruses, through droplets in the air, contaminated surfaces, and close contact with infected individuals. It infiltrates the respiratory system, causing symptoms that often mimic those of the common cold: cough, congestion, fever, and fatigue. For most people, these symptoms are mild, barely more than an inconvenience. But for seniors, the story is far more sinister. The elderly are uniquely vulnerable to HMPV for several reasons. With age comes a natural decline in immune function, a process known as immunosenescence. This means that even a virus that might seem innocuous to a younger person can have devastating consequences for someone whose defenses are already compromised. For many seniors, the danger is compounded by pre-existing conditions, heart disease, diabetes, chronic obstructive pulmonary disease, that make it harder for their bodies to fight back. HMPV doesn't just attack the lungs, it exploits every vulnerability in the body, turning a simple infection into a life-threatening crisis. Consider the case of Margaret, an 82-year-old widow living in a small, quiet town. Margaret was fiercely independent, still tending to her garden and baking for her grandchildren. But one winter evening, she began to feel unwell. She dismissed the symptoms as a cold, something she could manage with rest and hot tea. Days passed, and her condition worsened. Breathing became a struggle, her chest tight with an unrelenting pressure. By the time she was admitted to the hospital, it was too late. The doctors diagnosed her with severe pneumonia, a common complication of HMPV. Margaret passed away 3 days later, leaving her family grappling with an unbearable loss and a haunting question. Why hadn't anyone warned them about this virus? Margaret's story is not unique. In hospitals across the world, similar tragedies unfold every day. Yet HMPV remains underreported and underdiagnosed, often misidentified as influenza, RSV, or even COVID-19. This lack of awareness has dire consequences. Without accurate diagnosis, patients don't receive the targeted care they need. Families are left in the dark, mourning loved ones without understanding what truly claimed their lives. The parallels to COVID-19 are striking. Both viruses are respiratory pathogens, both spread easily in crowded settings, and both pose a significant threat to older adults. But while COVID-19 triggered a global response, with lockdowns, vaccination campaigns, and constant media coverage, HMPV has slipped under the radar. Why? Perhaps it's because HMPV doesn't ignite the same sense of urgency. It doesn't spread as explosively as COVID-19, nor does it have the high visibility of a pandemic. Instead, it creeps quietly through communities, its victims often dismissed as casualties of age or frailty. And yet, the numbers tell a different story. Research estimates that HMPV is responsible for tens of thousands of hospitalizations and deaths among seniors every year. These aren't just statistics. They are fathers, mothers, grandparents, and friends. They are people like Margaret, whose lives were cut short not by inevitability, but by a virus that remains dangerously overlooked. HMPV's ability to evade attention is part of what makes it so deadly. Testing for the virus is not routine, and even when tests are conducted, they are often inconclusive or delayed. This diagnostic gap leaves healthcare providers with little choice but to treat symptoms rather than the underlying cause, a strategy that often fails when dealing with such a formidable adversary. And there's another layer to this story, one that reveals the systemic failings that have allowed HMPV to flourish in the shadows. Funding for research into respiratory viruses has historically been skewed towards more prominent threats like influenza. Public health campaigns rarely mention HMPV, and most people remain unaware of its existence until it's too late. The consequences of this neglect are profound. Without widespread awareness, prevention efforts are minimal. Families don't know to take precautions, like avoiding crowded indoor spaces during peak respiratory virus season, or insisting on testing for elderly relatives with unexplained respiratory symptoms. So, where do we go from here? How do we bring HMPV out of the shadows and into the light? The answers are complex, but they begin with understanding. By examining the origins, transmission, and impact of HMPV, we can start to dismantle the barriers that have allowed it to remain hidden. We can push for better diagnostic tools, more robust public health initiatives, and greater accountability from the systems that are supposed to protect us. But even as we seek solutions, the clock is ticking. Every day, more lives are at risk. And as we delve deeper into this story, one question will remain at the forefront. How many more seniors must fall victim to this silent killer before we finally take notice? The story of HMPV is one of tragedy, but also of resilience. It's a story that demands our attention, our compassion, and our action. And as we continue to unravel the untold truth, we must remember that the fight against this virus is not just a medical battle. It is a moral imperative. because every life lost to HMPV is a life that could have been saved. And in the face of such preventable tragedy, silence is not an option. The story of human metapneumovirus is not one of sudden catastrophe. It doesn't erupt into the public consciousness with the fiery urgency of a pandemic or command the collective resources of nations overnight. Instead, it unfolds in the quiet corners of hospitals, the dimly lit bedrooms of elderly patients, and the grieving silence of families left to wonder what went wrong. In its shadowy existence, HMPV reveals a deeply troubling reality. A silent epidemic that has claimed countless lives while the world remains largely unaware. The reason isn't a lack of danger, it's a lack of recognition. Hospitals across the globe have seen its effects, but even seasoned healthcare workers sometimes fail to connect the dots. Many symptoms of HMPV, persistent cough, shortness of breath, fever, are indistinguishable from more familiar respiratory ailments like the flu, RSV, or COVID-19. Without mandatory testing protocols or widespread awareness, HMPV is often misdiagnosed or overlooked entirely. In 2023, a study conducted at a major urban hospital revealed a startling truth. As many as 10% of hospitalized respiratory cases among seniors were linked to HMPV, a virus few patients, and even fewer families, had ever heard of. These numbers weren't isolated. Public health organizations began piecing together a pattern, one that painted a grim picture of underreporting and systemic neglect. Take the case of John, a 74-year-old retired firefighter. For decades, he had faced danger head-on, battling flames and rescuing lives. But in late January, he found himself in a battle he couldn't comprehend. What started as a mild cold quickly escalated. Within days, John was gasping for air, his chest heaving with every shallow breath. His wife, Linda, rushed him to their local emergency room. Doctors initially suspected pneumonia, administering broad-spectrum antibiotics and oxygen therapy. But John's condition continued to deteriorate. Desperate for answers, Linda asked about testing for COVID-19. The results came back negative. Influenza? Negative. RSV? Also negative. Only weeks later, after an autopsy revealed the presence of HMPV in his respiratory tissues, did Linda finally learn the truth. But by then, it was too late. John had become another statistic in a growing, invisible epidemic. Why did it take so long to find the answer? The healthcare system, though robust in many respects, has critical blind spots when it comes to emerging or lesser-known pathogens. Testing for HMPV is not routine, even in cases where symptoms align with its profile. Many hospitals lack the resources or the protocols to conduct the specific diagnostics required to identify the virus. Interviews with frontline healthcare workers reveal a common frustration. One nurse, speaking on condition of anonymity, described the triage process as a guessing game. Limited by time, staffing shortages, and the sheer volume of patients, they are often forced to prioritize treatments for more well-documented illnesses, leaving HMPV to slip through the cracks. The problem isn't just at the bedside. It's systemic. Funding for research into respiratory viruses remains heavily skewed toward high-profile pathogens like influenza and COVID-19. HMPV, despite its deadly toll, has not received the same investment in public health education, diagnostic tools, or treatment protocols. The media, too, has played a role in HMPV's obscurity. In an age where headlines compete for clicks and airtime, stories about viruses often focus on the immediate, the catastrophic, or the easily sensationalized. HMPV, with its slow, insidious spread, lacks the dramatic hook that typically drives coverage. This absence of media attention creates a vicious cycle. Without awareness, there is little public pressure on health authorities to act. Without action, the virus continues to claim lives in the shadows. The story of HMPV is as much about the virus itself as it is about the systems that have allowed it to thrive unnoticed. It's about the families who grieve without answers, the patients who suffer without a name for their illness, and the healthcare workers who do their best within the constraints of an overwhelmed system. And yet, the question remains, how did we get here? How did a virus responsible for so much suffering become one of the best-kept secrets in public health? As we explore these questions, one thing becomes clear. The silence surrounding HMPV is not benign. It is a silence built on systemic failures, overlooked warning signs, and the human cost of inaction. But what will it take to break that silence? What will it take to ensure that no more lives are lost to a virus that thrives in the shadows? The answers lie ahead, in the untold stories of those who have faced HMPV head-on, and in the collective effort required to bring this hidden epidemic into the light. The heavy silence of a hospital room at night is a sound no one forgets. For 82-year-old Margaret Hayes, it was the backdrop to her final days. A retired schoolteacher with a love for gardening and crossword puzzles, Margaret had lived a quiet but full life. But in the cold grip of January, she found herself in a relentless battle with an invisible enemy. Her daughter, Carla, recalls the moment she realized something was wrong. "It started with a cough," she said, her voice trembling. "Just a little cough, like you'd get after a cold. But then she started getting weaker. She said her chest felt tight, like she couldn't quite catch her breath." Within a week, Margaret's condition had deteriorated so rapidly that Carla rushed her to the emergency room. Doctors suspected pneumonia at first, then perhaps complications from seasonal influenza. But the treatments didn't work. Margaret's oxygen levels plummeted, and her once vibrant spirit dimmed beneath the weight of an illness no one could name. Hours after Margaret's passing, a nurse pulled Carla aside. "She told me they'd found something," Carla said. "Human metapneumovirus. I didn't even know what it was, and now it's the word I'll never forget." Margaret's story is not unique. Across the country, families like Carla's are grappling with the devastating consequences of a virus most have never heard of. HMPV, a pathogen that primarily preys on the elderly and immunocompromised, is a ruthless predator that thrives in the shadows of ignorance and misdiagnosis. For Charles Whitman, a 77-year-old Korean War veteran, the virus came in the form of a sudden respiratory collapse. His son, Greg, describes the surreal moments leading up to his father's hospitalization. "He was fine at breakfast," Greg said, his voice breaking. "By dinner, he couldn't even walk to the bathroom without gasping for air." Doctors worked tirelessly to stabilize Charles, but the damage was already done. They kept testing for COVID, for the flu. Everything came back negative, Greg explained. By the time they thought to test for HMPV, it was too late. He never even got the chance to fight it. The pain of loss is compounded by the frustration of unanswered questions. Families are left wondering, could more have been done? Why wasn't this virus on anyone's radar? These are questions that haunt not just the grieving, but the healthcare workers on the front lines. Dr. Emilia Torres, a pulmonologist in New York City, has seen the devastation of HMPV up close. "It's heartbreaking," she said. "You're trying to save someone's life, and you realize you're fighting an enemy you didn't even know was in the room. Despite the challenges, there are glimmers of hope. In laboratories and hospitals across the globe, researchers and doctors are working tirelessly to shine a light on HMPV. Dr. Torres has been part of a grassroots effort to raise awareness among her peers, advocating for more routine testing and early detection methods. "We can't fight what we don't see," she said. "But when we know it's there, we have a chance, even if it's just a small one." One of those small chances came in the form of a breakthrough in Dallas, where researchers identified a correlation between early intervention and survival rates in elderly patients. Dr. Alan Reed, a virologist leading the study, described the findings as a beacon in the dark. "It's not a cure," Dr. Reed cautioned, "but it's a start, and for every life we can save, it's worth it." The fight against HMPV is not without its heroes, but it is also fraught with emotional and physical exhaustion. Nurses recount the anguish of holding the hands of patients taking their final breaths, their families unable to be present due to restrictive hospital protocols. One nurse, who asked to remain anonymous, shared the story of an elderly couple who had been married for 62 years. "She came in first," the nurse said. "A week later, he followed. They were in separate rooms. Neither of them made it. I'll never forget how he kept asking for her until the very end." These are the stories that drive healthcare workers to push forward despite the odds. They are stories of loss, yes, but also of love, resilience, and the determination to make a difference. Yet, for every heroic effort, there remains the crushing reality of a system ill-equipped to handle an invisible epidemic. Testing for HMPV is still not standard practice, even in high-risk populations. Without broader awareness, the virus continues its quiet rampage, taking lives one breath at a time. As the narrative unfolds, we are left with an unsettling question. How many more stories like Margaret's, Charles's, and the unnamed couples will it take before the world begins to pay attention? Perhaps the answer lies not just in the labs and hospitals, but in the collective will of those who have borne the weight of this epidemic. The families, the doctors, the researchers, they are the voices that refuse to be silenced, the ones who demand that no more lives be lost to a virus that thrives on neglect. Their stories remind us of what's at stake. And as we continue to uncover the untold truth about HMPV, one thing becomes clear. This fight is far from over. The line between vigilance and vulnerability is often thinner than we imagine. For seniors, that line can be crossed quietly, almost imperceptibly, in the form of an unassuming cough or a fleeting fever. These are the subtle early signs of human metapneumovirus, or HMPV, a virus that masquerades as a common cold but harbors the potential to devastate. For 73-year-old Eleanor Jacobs, it began with fatigue. A retired librarian, Eleanor took pride in her independence. She lived alone, walked her dog every morning, and tended a small garden in her backyard. When she woke one morning feeling unusually tired, she dismissed it as nothing more than a restless night. But over the next few days, the symptoms escalated. A persistent cough followed, then shortness of breath. By the time she sought medical help, her oxygen levels had dropped dangerously low. Stories like Eleanor's are tragically common, yet preventable. One of the most insidious aspects of HMPV is how it blends into the background noise of seasonal illnesses. The symptoms, cough, fever, congestion, are easily mistaken for the flu or even allergies. This overlap is particularly dangerous for seniors, whose bodies are less equipped to mount a robust immune response. Recognizing these early warning signs can be the difference between life and death. Dr. Michael Harper, a geriatric specialist, explains the urgency of early detection. The challenge with HMPV is that it doesn't announce itself. It creeps in under the radar, he says. By the time it's identified, the virus has often done significant damage to the respiratory system. Awareness of these symptoms is crucial, not just for seniors, but for their caregivers and families. The virus targets the lungs with precision, causing inflammation and fluid buildup that make breathing increasingly difficult. For seniors already grappling with chronic conditions like asthma, COPD, or heart disease, HMPV can be a catastrophic tipping point. But there is hope. Prevention begins with strengthening the body's natural defenses. While no immunity is foolproof, lifestyle adjustments can significantly reduce the risk of severe illness. Nutrition plays a pivotal role. Dietitian Rachel Lynn underscores the importance of a balanced diet rich in immune-boosting nutrients. Foods high in vitamin C, like citrus fruits and leafy greens, support the production of white blood cells, which are essential for fighting infections, she explains. Zinc, found in foods like nuts, seeds, and lean meats, can help shorten the duration of respiratory illnesses. Hydration is equally critical. Seniors are more prone to dehydration, which can weaken the immune system. Encouraging consistent fluid intake, even when symptoms are mild, can provide an additional layer of protection. Regular physical activity is another cornerstone of prevention. For many seniors, the idea of exercise may feel daunting, but even light activities like walking or yoga can improve cardiovascular health and lung capacity, making the body more resilient to respiratory infections. But even the healthiest lifestyle cannot guarantee immunity, and this is where medical advancements come into play. Scientists are racing against time to develop a vaccine for HMPV. Dr. Karen Patel, an infectious disease researcher, is at the forefront of this effort. We're in a critical phase, she says. The virus has been known to us for decades, but it's only in the last few years that we've begun to fully grasp its impact on vulnerable populations, especially seniors. Preliminary trials have shown promise, with several experimental vaccines demonstrating an ability to stimulate immune responses in older adults. However, challenges remain. Unlike vaccines for influenza or COVID-19, which target well-studied pathogens, HMPV is still a relatively under-researched virus. Its genetic variability adds another layer of complexity to vaccine development. While the wait for a vaccine continues, emerging therapies offer a glimmer of hope for those already infected. Antiviral treatments, designed to mitigate the severity of respiratory infections, are being repurposed to combat HMPV. In some cases, these therapies have reduced hospitalization rates by as much as 30%. One of the most promising developments is the use of monoclonal antibodies, lab-engineered proteins that mimic the immune system's ability to fight off harmful pathogens. These treatments, though still in their infancy, could be a game changer for high-risk patients. For caregivers, staying informed is perhaps the most powerful tool in the fight against HMPV. Understanding how to spot symptoms, when to seek medical help, and how to create a supportive environment can save lives. But awareness must extend beyond individual households. Public health campaigns, community programs, and legislative action are needed to elevate HMPV from obscurity and place it firmly on the radar of healthcare providers and policymakers alike. As the narrative of prevention unfolds, we are left with a pressing question. How many lives could be saved if action were taken sooner? The answer lies not just in the hands of researchers and clinicians, but in the collective will of a society that refuses to let its most vulnerable members fade into the shadows. Prevention is not just a medical imperative, it is a moral one. For Eleanor Jacobs and countless others, the battle against HMPV is a reminder that even the smallest actions, recognizing a cough, preparing a healthy meal, or advocating for better healthcare, can have life-altering consequences. And as we move forward, one thing becomes clear. Prevention is not just about protecting lives. It's about honoring them. It begins with a whisper, a soft murmur lost in the cacophony of louder crises. For years, the silent danger of human metapneumovirus, HMPV, has crept through senior communities, unnoticed by most, unspoken by many. But silence has a cost, and for thousands, that cost has been fatal. The stories are hauntingly similar. A routine cough dismissed as a seasonal cold. A visit to the doctor that comes too late, a life extinguished without fanfare, leaving loved ones grappling with questions and grief. These are not isolated tragedies. They are part of a larger, systemic failure to recognize and combat an insidious threat. But what if that silence could be broken? What if, instead of quiet acceptance, there was a collective demand for change? Raising awareness is not just the first step. It is the catalyst for saving lives. It starts with a conversation between parents and their grown children, between patients and healthcare providers, between neighbors and friends. The simple act of speaking about HMPV can shift it from the shadows into the spotlight. Consider Anne Livingston, a retired teacher who lost her husband, Richard, to the virus. "I had never even heard of HMPV until it took him from me," she says, her voice breaking with emotion. "If I had known, maybe things would have been different. Maybe I could have done something." Anne's words underscore a harsh truth. Ignorance isn't bliss, it's a barrier. And breaking that barrier requires more than individual efforts. It demands a collective movement. Healthcare professionals play a pivotal role in this effort. Dr. Elena Morales, a pulmonologist, recalls the frustration of diagnosing HMPV in its later stages. "By the time we identify it, the damage is often done," she explains. "What we need is a proactive approach. Testing, education, and awareness at every level of care. Improved diagnostic tools are crucial. Unlike influenza or COVID-19, which have widely available tests, HMPV often requires specialized diagnostics that are not routinely offered. This gap in testing leaves many cases undetected, contributing to its underestimation as a public health threat. Advocacy groups are now pushing for the integration of HMPV testing into standard respiratory panels. The stakes are high, and the urgency is palpable. In a world where healthcare systems are already stretched thin, prioritizing a relatively unknown virus can seem like an uphill battle. But history has shown that change is possible when voices unite. Public health campaigns have transformed the landscape of disease awareness before, from HIV to breast cancer. The lessons learned from these movements are clear. Visibility matters. When a disease becomes part of the national conversation, it becomes harder to ignore, harder to underfund, harder to dismiss. Community engagement is another critical piece of the puzzle. Caregivers, often the unsung heroes in the fight against HMPV, need access to reliable resources and support networks. For many, the journey begins with local organizations dedicated to senior health. These groups can provide everything from educational seminars to practical tools for prevention. One such initiative is the Breathe Easy Coalition, a grassroots organization founded by a group of nurses in a small Midwestern town. Their mission is simple: Arm families with the knowledge they need to protect their loved ones. Through workshops, flyers, and an active online presence, they are creating ripples of change in their community. For caregivers like Sarah Mitchell, a 38-year-old mother of two who also looks after her aging father, these resources have been a lifeline. Before I found the coalition, I felt so alone, Sarah shares. I didn't know what to look for or how to help. Now, I feel empowered to make decisions that could save my dad's life. The ripple effect of such efforts cannot be overstated. Each informed caregiver becomes an advocate, each advocate a beacon of awareness in their own circle. But awareness is only one side of the equation. Advocacy for systemic change is the next frontier. Policies that prioritize funding for research, streamline the approval of diagnostic tools, and ensure equitable access to healthcare are vital. Grassroots efforts can amplify this message, but sustained change requires buy-in from policymakers and institutional leaders. It requires petitions, letters to Congress, and a groundswell of public demand that can't be ignored. The question remains, will we rise to the challenge? Or will we continue to let seniors bear the brunt of this silent epidemic? In the final analysis, the call for change is not just a plea for action. It is a testament to humanity's capacity for resilience and compassion. By raising our voices, we affirm that no life is too small, no struggle too insignificant to merit our attention. And as the tide of awareness grows, the silence surrounding HMPV begins to fracture, replaced by a chorus of determination and hope. The fight is far from over, but the first steps have been taken. Now, it's up to all of us to ensure they are not the last. As the clock winds down on our journey through the untold truths of human metapneumovirus, one undeniable reality emerges. Silence has been the virus's greatest ally. HMPV, a name unknown to many, has quietly claimed lives, stolen futures, and left families grappling with grief they could never have anticipated. But today, that silence ends. Let's revisit the critical points of this story. HMPV is not a distant concern. It's here, now, affecting the most vulnerable among us. Seniors, already battling the frailties of age, are its primary victims. For them, what begins as a simple cough or low-grade fever can rapidly spiral into respiratory distress, hospitalization, or worse. We've uncovered the alarming gaps in awareness, the insufficiencies in diagnostic tools, and the urgent need for preventative measures. We've seen how this virus thrives on ignorance, how its very obscurity allows it to evade the attention it so desperately warrants. But we've also seen hope. Hope in the resilience of caregivers like Sarah Mitchell, who transformed her fear into action. Hope in organizations like the Breathe Easy Coalition, fighting tirelessly to spread knowledge and resources. Hope in the power of human connection, where every conversation about HMPV becomes a ripple in the tide of change. This isn't just a story about a virus. It's a story about humanity, our capacity to protect one another, to care for the vulnerable, and to fight for a future where preventable deaths are truly prevented. So, what can you do? Start by sharing this story. Talk to your loved ones, especially those who may be at risk. Ask questions at your next doctor's visit about HMPV, about testing, about steps you can take to safeguard your health and the health of those you love. And don't stop there. Share this video. By spreading awareness, you're not just educating others, you're saving lives. Every share, every conversation, every moment spent bringing this virus out of the shadows is a step toward a safer future. Take action by exploring the resources we've provided. In the video description, you'll find downloadable guides filled with practical tips on prevention, symptoms to watch for, and how to advocate for better healthcare policies. You'll also find links to related videos that dive deeper into the science, the stories, and the solutions surrounding HMPV. Together, we can rewrite this narrative. Together, we can ensure that no senior suffers in silence, no family is blindsided by an avoidable tragedy, and no life is lost to a virus we have the power to combat. As we close, we'd like to thank you for joining us on this journey. Your engagement, through likes, shares, and comments, has the potential to turn this awareness into a movement. For our subscribers, your support means everything to us. For those who are new to our community, we invite you to join us. Hit that subscribe button and turn on notifications so you'll be the first to know when we release more life-saving content. And if there's a health condition or concern you'd like us to explore, let us know. Your voice matters, and your request could be featured in a future episode, helping countless others in the process. Remember, knowledge is power, and in the case of HMPV, it's the power to save lives. Thank you for being part of this critical conversation. Together, we can ensure that the untold truth of HMPV is no longer untold.